So let's talk a little about rhinoplasty or nose surgery. My philosophy about the nose surgery is that each person kind of knows what they want. They may know something that bothers them about that nose, and I can kind of make suggestions as to what I feel would look good, but I really like to tailor it to what the patients want. And I think it's really, really important that your expectations match your outcome, and that's really the most important thing in that surgery, that you're happy with the surgery. If you expect one thing and something else comes out, then that's when you're not going to be happy with that surgery. There are a few particular things that are real common things that people sort of seek and that make the nose look better. One is this dorsal, we call the dorsum, or the dorsal area can be prominent in that area, what some people call a hump on the nose, something like that, that can be reduced. Another thing we can do is sort of thin in this area right here to make the nose look more narrow and even and get sort of a smooth aesthetic line down this way, so that the nose flows with the face. Other things, many times people will have a wide, we call boxy area, and we call this area we call the tip. That can be narrowed and refined, and to get enough projection so that the whole nose balance looks nice and makes the nose look cute. Those are some of the more common things that people would do for the nose. But really, what really requires a personal interaction and a consultation, because that's when we can kind of see exactly what in particular your concerns are, and I can kind of match that with the things that I can change, and we come up with a nice plan that you can kind of see exactly what you want, and so we can get the nose that you want. Some doctors, they do kind of like what we call cookie cutter nose, where every one of their nose patients looks exactly the same. Well, some people don't want that look. They may want other things, or some people may want to keep certain things about their nose, and those are things that I like to sort of custom decide with the patient so that they get exactly what they want. So recovery from nose surgery or rhinoplasty is surprisingly easy. It doesn't particularly hurt that much. I give everybody pain pills, but a lot of people say they hardly take them or even don't take them. And you're probably ready to go back to doing things like driving and working after a few days. But many people will take the time off of work because frequently we have what we call a splint, which is kind of like a little metal bent over your nose for 1 week. And so many people don't want to go to work with that on, or explain to people why they have that on. So that's why many people would keep that, because of that splint for a week, would take that week off of work. Frequently there would be a couple of little stitches down here that we would take out after about a week or so. And then as far as activities, mainly you want to avoid contact sports, because the nose will be a little soft, particularly in this area here. You don't want to bump it or get elbowed playing basketball or other types of sports. So you want to avoid those kinds of contact sports or anything where you might bump your nose for about a month or so. After a month, it builds strength just like a normal nose, but for that first month, you really got to take it easy in that way. Also, as I do recommend frequently in other surgeries, for 2 weeks I recommend that you do not exercise, and then kind of start with some light exercise after that, ease your way back into it. By 6 weeks you can pretty much do just about anything. Along with the nose, and I always evaluate, when I'm evaluating somebody's nose, I always look at the chin, because they're very integrated in terms of how it looks, and in particular if the chin is sort of set back, it tends to make the nose look much larger, and so in those cases frequently we would add a chin implant to bring the chin to the appropriate position, and then it makes the nose look much more in balance with the face and gives a really nice profile.